Aloha Kauai, here's our daily COVID-19 briefing from Team Kauai for Tuesday, May 12th. Our cumulative number of confirmed cases remains at 21, and all cases have now recovered or left the island. This means we have no confirmed active cases of COVID-19 on Kauai at this time. Kauai's tally of cases and other information on COVID-19 can be found on the Kauai Emergency Management Agency or KEMA site at www.kauai.gov/COVID-19. To view the total number of positive cases across the state, please visit hawaiicovid19.com. The daily count on this site is updated at noon every day. One of the terms we hear a lot these days is contact tracing, how important it is and how it is changing with improved technology. I wanted to talk a little bit about it. When a person is confirmed to be infected with coronavirus, health officials conduct a detailed investigation into their activities to try to identify anyone who might have had close enough contact to be at higher risk of infection. It might be family or coworkers, a healthcare provider, or even someone you exercise with. The tracing doesn't stop there. Once the contacts are identified, they are educated about their risk. All close contacts are quarantined for 14 days after they were exposed. During that time, a public health nurse checks with them twice daily, and they are tested if they become ill. They may be quarantined at home, or if that is not possible, the Department of Health arranges quarantine elsewhere. Daily phone calls to large number of contacts can take a lot of time. Technology is starting to help. The State Department of Health recently announced that it has started using a new web application called HealthSafe, which will allow contacts to check in online or by text rather than waiting for a phone call. Contact tracing is critical to managing a new outbreak of the disease, and once we reopen our island to large numbers of travelers, we can expect new cases. New technology will help us respond more effectively than we could when this all started. This is another key tool as we figure out the best way for us to safely reopen our economy. We are now a couple of months into this pandemic's impact on our island. It has been a long time, and although we seem to be moving in the right direction, the disruption in our lives will continue for a while more. Many of us may be suffering from anxiety in these troubled times. The Kauai District Health Office provided some thoughts on helping us cope. Loneliness, boredom, fear of getting sick, anxiety, low mood, and stress are normal reactions to this kind of event. Here are some tips that may help. Stay informed, but know that it helps to check the accuracy of your news sources. The Hawaii Department of Health and the U.S. Centers of Disease Control and Prevention maintain accurate websites on the coronavirus outbreak. It also helps to limit the amount of time you spend reading updates and the number of times you check in. It helps to balance your news and social media use with other activities, like reading, spending time with household members, and exercising. Keep in touch with family and friends using phone calls, text messages, and video chats. Keeping connected can help share feelings and relieve stress. It also helps to try to keep some consistency by keeping your family schedule familiar, trying to maintain the same meal times, bedtimes, wake-up times, work and exercise times. Talk to your children with honest and age-appropriate information about what is going on. And remember, they take their own cues from your behaviors and emotions. During these difficult times, the best that we can do for one another is to be kind and show aloha. A simple smile or greeting to a stranger could change the course of their day. If someone treats you rudely, show grace, as we never know what someone is dealing with. Remember, aloha is free, and we should give it freely. But if these tips don't seem to help, and you're experiencing severe anxiety, lingering sadness, or other reactions that may be impacting your personal relationships or daily interactions, please consider seeking professional help. Psychologists and other mental health professionals are available. If you need help immediately, call the State Department of Health crisis line at 1-800-753-6879, or on your phone, text Aloha to 741 741 or visit nami.org/help. If you need police assistance, you can call the police dispatch non-emergency line at 241-1711. If you're in an active emergency, call or text 911. Look, folks, I'm just like all of you. There's going to be good days and there's going to be bad days. I myself am not immune to the anxiety of uncertainty and to the fear of getting sick. At times, it can feel extremely lonely. I am just as vulnerable to all of these symptoms as all of you are. And I know at times, during times of fear and uncertainty and anxiety, the first thing people would turn to is anything that will numb that fear and anxiety. I am also not immune to this as well. For me, sobriety has been a challenge during this pandemic, but I find the strength to move forward because I know that the best thing for me to do is remain a state of calm. In the coming days, we'll provide some contacts that I find as my personal strength and the folks that I reach out to that are influential. So please stay tuned as we'll be providing those numbers of my personal circle of influence that can provide the strength to help you get through all of this. Together we can do this, folks. There is light at the end of the tunnel. This pain is temporary, and we're going to get through this, and there will be brighter days ahead. The bottom line is that there are people out there who care about you and want to help. And on that note, I'd like to say mahalo to all those who work in the State Department of Human Services, crisis counseling, and others who work around the clock to help connect people with food, housing, and medical assistance, domestic violence, or other abuse prevention and assistance, and other resources to help people navigate this difficult time. Thank you for your compassion and your work to help those in need. For more information on the SNAP food stamp program, MedQuest, or other social services, please visit the state DHS website at humanservices.hawaii.gov. We're going to get through this, Kauai. Stick together and work to help one another. We all play a role in preventing the spread of this disease by incorporating simple behaviors in our daily lives. This means stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, maintain a distance of 6 feet of separation and wear a mask. Do not leave home if you're sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Be kind, take care of one another. God bless, and aloha.